Joining me now in our newsroom is Dr. Ram Muletti. He is the Chief Physician Executive at Community Health. Always great to see you. Thanks for jumping on.
Absolutely.
Okay, so we have the rising Delta, with Delta around, there's hospitalizations, deaths, mostly in unvaccinated people in their 30s, 40s, and 50s. Can you speak to how nobody is spared from this virus despite being young and healthy?
Yeah, I think that's one thing people need to truly understand is that this variant truly is different from all the other things we've seen the coronavirus in the past 18 months, that it's so infectious that it affects anybody and everybody. So as you said, the vast majority of our patients in our hospitals are younger, and also they're not that there used to be not any other comorbidities or health issues. So we're seeing people that we have not seen before, and they're getting very, very sick. So it's not just the elderly with a lot of health issues. It's about anybody you could think of that's getting it right now.
Right, as we were seeing before, right, previously with the, I guess, original strain, which I don't even know is even circulating anymore, right, it was the most vulnerable and we were more protected if we were younger or healthier, we ate well, we exercised, but that doesn't matter.
That's correct. Right now, 98% of the cases in the US are the Delta variant. So there's really no other variant right now. There's other newer variants coming, but it's all Delta. And the good news is that for those high-risk populations, a lot of them already got vaccinated. So thankfully, we're not seeing a lot of those people in our hospitals. But clearly now is just a pandemic of the unvaccinated. Everybody we're seeing in the hospital, they're on the ventilators or not doing well, is almost always unvaccinated. And that's just really difficult to see.
Dr. Muletti, those words really resonate, the pandemic of the unvaccinated. So from what I understand, the immune system goes into chaos when infection occurs if a person is unvaccinated. I mean, just chaos. It doesn't recognize what's going on. However, if vaccinated, the body recognizes the virus and knows exactly what to do. Can you elaborate on that?
Yeah, that's actually the entire point about the vaccination. So the problem with the coronavirus, the problem people get sick, is that when you're not vaccinated, the virus will infect you. The virus stays in the body just for a few days, but it leaves. But then it causes massive inflammation in what's called a cytokine storm. And that inflammation starts to attack our own body and starts eating up our lungs, our heart, and everything else. The idea with the vaccine is that you get a teeny tiny shot of this. It's not the virus at all, but it triggers the immune system just enough for it to recognize when the real thing comes. So when the real thing comes, the immune system is actually controlled, not out of control, and is really controlled and takes care of the virus right away. It's all about the immune system and how we could kind of rig it up to get ready for it. Whereas if you don't have the vaccine, our immune system doesn't know what to do. It just goes into chaos and starts attacking everything.
So we really need to pre-activate our immune system to recognize this virus with the vaccine.
That's not right. And once we recognize with the vaccine, when it comes along, within a matter of a couple of days, it squelches the entire virus. So there's no more immune response, and we do very, very well. It's really phenomenal how this small vaccine can make such a big difference in terms of controlling our own immune system.
Right, that's unbelievable. Your message to those who are unvaccinated, young, healthy, eat well.
It's very simple. Right now, everybody thinks it's not going to affect me. It's going to affect my neighbor or somebody else. I'm in great shape. I can't tell you how many young people we've been seeing, and even people that are in college, football players, and so on. It can truly affect anybody. And so you just don't want to be one of those people. And even if you don't get sick in the hospital, even today, I am seeing people that have had COVID several months ago, still not doing well, still tired, still sleeping, brain fog. So you really don't want to get the coronavirus no matter what.